Dr. Khan, we have seen the number of cases decline after a spike in June. Is that because the social distancing and other measures have been working?
Yeah, absolutely. I think it's very fascinating observations that we peaked in the middle of June, and everybody at that point was predicting our worst case scenario, looking at the modeling of Imperial College, that we were going to get something like 30,000 deaths a day. And WHO was warning us as well. And then something happened. Immediately, we saw now 80% to 90% decline in cases, almost whatever parameters you want to use it. There are many factors, probably one can postulate in the context of Pakistan. Of course, there was a lot of campaign of the prevention, cutting down the transmission by wearing the face masks, social distancing. And I think one interesting phenomenon related to Pakistan was a smart lockdown. Initially, people thought how it's going to work, but it really worked. We must remember that we have a very trained polio team which know almost every street in every city. So they were very handy. They could point out exactly this particular street in this particular locality is most people have been identified. You could just lock down that street rather than the whole locality.
So are you saying, this is a very interesting thing saying, Dr. Khan. So you're saying that the mechanism that we used for polio vaccination is the mechanism that we also employed for detection of coronavirus and identifying streets and the areas which needed to be smartly locked down?
Precisely, that's the observation, because no one has so much trained staff on ground as Pakistan has for the polio vaccination. So that what they were used for this strategy, and it appears to be working. And in the other phenomena, like we have the young population as compared to the others, but again, the other economy has the same younger population. Our average is 22 in Pakistan. We don't have the elderly population.